Contact dermatitis. Contact dermatitis is a red, itchy rash caused by direct contact with a substance or an allergic reaction to it. The rash isn't contagious or life-threatening, but it can be very uncomfortable. Many substances can cause such reactions, including soaps, cosmetics, fragrances, jewelry, and plants. To treat contact dermatitis successfully, you need to identify and avoid the cause of your reaction. If you can avoid the offending substance, the rash usually clears up in 2 to 4 weeks. You can try soothing your skin with cool, wet compresses, anti-itchy creams, and other self-care steps. Contact dermatitis usually occurs on areas of your body that have been directly exposed to the reaction causing it. For example, along a calf that brushes against poison ivy or under a watch band, the rash usually develops within minutes to hours of exposure and can last to 2 to 4 weeks. Signs and symptoms of contact dermatitis include a red rash, itching, which may be severe, dry, cracked, scaly skin, bumps and blisters, sometimes with oozing and crusting, swelling, burning, or tenderness. See your doctor if the rash is so uncomfortable that you are losing sleep or are distracted from daily activities. The rash is a sudden, painful, severe, or widespread. You're embarrassed by the way your skin looks. The rash doesn't get better within 3 weeks. The rash affects your face or genitals. Seek immediate medical care in the following situations. You think your skin is infected. Clues include fever and pus oozing from blisters. Your lungs, eyes, or nasal passages are painful and inflamed, perhaps from inhaling or allergen. You think the rash has damaged the mucous lining of your mouth and digestive tract. Contact dermatitis is caused by substance you're exposed to that irritates your skin or triggers an allergic reaction. The substance could be one of the thousands of known allergens and irritants. Some of these substances may cause both irritant contact dermatitis and allergic contact dermatitis. So there are two types of contact dermatitis: irritant and allergic. Irritant contact dermatitis is the most common type. This non-allergic skin reaction occurs when substance damages your skin's outer protective layer. Some people react to strong irritants after a single exposure. Others may develop signs and symptoms after repeated exposure to even mild irritants, and some people develop a tolerance to the substance over time. Common irritants include solvents, rubbing alcohol, bleach and detergents, shampoos, permanent wave solutions, airborne substances such as sawdust or wool dust, plants, fertilizers, and pesticides. Allergic contact dermatitis occurs when a substance to which you're sensitive or allergic triggers an immune reaction in your skin. It usually affects only the area that comes into contact with the allergen, but may be triggered by something that enters your body through foods, flavorings, medicine, or medical or dental procedures. You may become sensitized to a strong allergen such as poison ivy after a single exposure. Weaker allergens may require multiple exposures over several years to trigger an allergy. Once you develop an allergy to a substance, even a small amount of it can cause a reaction.
Basically, your immune system in allergic contact dermatitis, it declares this certain substance as harmful and declares a immune response to it. So yeah.
Common allergens include nickel, which is used in jewelry, buckles, and many other items, medications such as antibiotic creams and oral antihistamines, balsam of Peru, which is used in many products such as perfumes, cosmetics, mouth rinsings, and flavorings, formaldehyde, which is in preservatives, disinfectants, and clothing, personal care products such as deodorants, body washes, hair dyes, cosmetics, and nail polish, plants such as poison ivy and mango, which contain a highly allergic substance called the urushiol. Airborne substances such as ragwood, pollen, and spray insecticides. Products that cause a reaction when you're in the sun, such as sunscreen and oral medications. Children develop the condition from the usual offenders and also from exposure to diapers, baby wipes, sunscreens, clothing with snaps or dyes, and so on.
Okay, so what puts you at risk of developing contact dermatitis? Basically, anything that puts you that irritates or um, that's your skin is allergic to, stay away from. And ways to protect you from those are and jobs that put you in contact with those is being a healthcare worker and dental employee, metal workers, construction workers, because have they are in contact with a lot of metals and all kinds of substances. Hairdressers and cosmetologists, because they are with like in contact with a lot of cosmetics and soaps and things that can cause allergies and irritation. Auto mechanics, scuba divers, and swimmers due to the rubber in face masks or goggles. We talked about latex allergies, and these rubbers usually have substance that is or related to similar to latex. Cleaners, because they have to deal with a lot of chemicals. Gardeners and agricultural workers, fertilizers and pesticides. Cooks and others who work with food. Next slide. What could possibly happen if you have contact dermatitis? Like, why is it so bad? Um, Usually, it's not so bad. What could happen is if you have an allergy and you itch it, or if it causes any type of opening in your skin, you could be prone to infections such as bacterial or viral or fungi or anything that could be bad. Uh, yeah, next slide. Prevention. What can you do to prevent contact dermatitis? We'll basically avoid all irritants and allergens. Try to identify and avoid substances that you're allergic to. Wash your hands. Um, if your hands don't come into contact with them, I mean, it won't have the allergy. So washing your hands and cleaning it, make sure your hands are clean. Uh, Helps. Wear protective clothing and gloves, especially when you're dealing with the allergen itself. Um, and make sure the gloves or clothes don't actually include the allergen. Apply an iron on patch to cover metal fasteners next to your skin. This can help you avoid the reactions to gene snaps, for example. Apply barrier cream or gel. These products can provide a protective layer for your skin. Basically, any moisturizer or gel can provide the defense against any foreign substance. Protective layer. Use moisturizer. Take care on pets. Allergens from plants such as poison ivy can cling to pets and they can spread to people. So not only the subject itself, not only the allergen itself. For an example, let's say you're allergic to pesticides, and then your dog goes into the garden and uh, all the pesticide is on his feet, and then you touch the dog, you might get an allergic might be have a reaction to the pesticides. Just an example. Next slide. Diagnosis. Your doctor may be able to diagnose contact dermatitis and identify its cause by talking to you about your signs and symptoms, questioning you to uncover clues about the trigger substance, and examine your skin to note the patterns and intensity of your rash. Basically, the best way is just see what you have been in contact with and look at the rash itself and gather clues to see what exactly happened. Your doctor may recommend a patch test and see if you're allergic to something else. This test can be useful if the cause of your rash isn't apparent or if your rash recurs often. During a patch test, small amounts of potential allergens are applied to adhesive patches, which are then placed on your skin. The patches remain on your skin for 2 to 3 days, during which time you'll need to keep your back dry. Your doctor then checks for skin reactions under the patch and determines whether further testing is needed. Basically, he checks what you're allergic to by doing small tests that are harmless, and he checks with different substances on your skin and see if you're allergic to any of them. Next, treatment. If home care steps do not ease the symptoms, such as the cooling cloth, for example, your doctor may prescribe medication. Such medication are steroid creams and ointments. These typically applied cream or ointments help soothe the rash of contact dermatitis. A topical steroid may be applied 1 or 2 times a day for 2 to 3 weeks. So basically, creams and ointment that um, heal up the rash. Oral medication. In severe cases, your doctor may prescribe oral corticosteroids to reduce inflammation, antihistamines to relieve itching, or antibiotics to fight bacterial infection. Next slide. Lifestyle and home remedies that could reduce itching and soothe inflamed skin, or to avoid the irritants or allergens. We already talked about this. Anything that causes your allergy, stay away from, or wear protective clothing against it. Apply an anti-itch cream or lotion to the affected area. One of the worst things that could happen is um, you have a rash and then it's itchy and you itch it so much that it opens up the skin and puts you prone to infections, such as bacterial infections. And we talked about all sorts of bacterial and viral infections before. So, yep. Apply an anti-itch cream or lotion to the affected area. A non-prescription cream containing at least 1% hydrocortisone, can temporarily relieve your itch. A steroid ointment may be applied to 1 or 2 times uh, for 2 times a day for 2 to 4 weeks. Next slide. Take an oral anti-itch drug, basically things that stop the itching. Apply cool, wet compresses, moisten soft washcloth, and hold them against the rash to soothe your skin for 15 to 30 minutes, and that removes some itch um, and pain. Avoid scratching. Trim your nails and avoid scratching. You don't want to open up your skin for bacteria. Soak in comfortably soothing bath. Sprinkle the water with baking soda or an oatmeal-based bath product that has to do with pain removal. Protect your hands, wrists, and dry hands well and gently after washing. Use moisturizer throughout the day. We know moisturizer could be a protective layer, and choose glove based on what you're protecting your hands from. For example, plastic gloves lined with cotton are good if your hands are often wet.